hanggang sa dulo. Ano man ang pagsubok, isusuko. Alam kong kaya mo. Sige lang, sige, sige lang, sige. Walang imposible. Walang imposible. Nagniningning ang pangarap ng iyong pusong humihiling. Nakalimutan ang kahapon, sana'y dinggin. Sigaw ng aking puso, hindi susuko, hindi susuko.
Ilabas ang iyong pangarap, huwag mo yang itatago. Samahan mo ng sipag at tatag ng puso. Tumayo ka sa iyong silya, ikaw ngayon ang bida. Wala nang pipigil pa, eto na, eto na.
Walang imposible, sige lang, sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo. Sige lang, sige, sige lang, sige. Walang imposible. Napapagod, naiinip, natatawa, nagtataka, naiinggit, nagagalit, nangangawit, nabibigla, nalulungkot, nabubugnot, nahihiya, natutugso, nakukonsensya, nauubusan din ang pasensya, nasasaktan, nagmumura, pero lumalaban pa rin dahil natuto na.
Hanggat ako'y humihinga, sugod ng laban pa. Pangarap pabuting, kumislap tulad ng mga bituin. Sige lang, di ka nag-iisa. Sige lang, sige pa.
Walang imposible, sige lang, sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo. Sige lang, sige, sige lang, sige. Walang imposible, sige lang, sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo. Sige lang, sige, sige lang, sige. Walang imposible. Walang imposible.
Kung kaya ko, kaya mo. Sige lang, sige. Eto na naman tayo bagong simula.
Good morning, everyone, especially to my section. Also, good morning to those watching us from live stream. All right, so for today, sorry, that's my baby. So for today, we will have our Pharmacology Quizmaster session from 7 to 8 a.m. All right. So before we start, allow me to share some slides with you. Yawn. Kala ko nawawala na yung slide. Okay. Okay, so Quizmaster session. Oh, wait, ito ba yung slide? All right. So, number 1, AJ, an 8-year-old male, underwent myeloablation using a bisulfan-containing regimen, busulfan. The patient complains of recently always feeling full. He later on developed right upper quadrant abdominal pain and icteric sclera 10 days after HSCT. The patient is a febrile, mildly tachycardic with an RR of 30. What is your primary consideration? So is it A, acute cholangitis, B, pulmonary fibrosis, C, or hepatic veno-occlusive disease, D, acute graft versus host disease? Okay, so timer starts now. You can chat your answer sa chat box. Don't worry, there's no wrong answer. And for those at home, you can write your answer down. All right. Next question. Number 2, which of the following may prevent or reverse AJ's condition? So is this MPPT, B, leucovorin, C, defibrotide, or D, pirfenidone? Which of the following may prevent or reverse AJ's condition? Is it A, MPPT, leucovorin, defibrotides, or pirfenidones? All right, time's up. Next question. The following statements regarding the autonomic nervous system are correct. Is it A, axillary sweat glands are innervated by your sympathetic neurons which secrete ACTH? B, postganglionic sympathetic neurons are unmyelinated? C, all preganglionic autonomic neurons are myelinated? Or D, preganglionic sympathetic neurons secrete ACTH? Okay, timer's up. Next question, number 4. Which of the following is the cornerstone of your pharmacologic therapy in patients with non-decompensated HFrEF or HFrEF na tinatawag nila? Is it A, neurohormonal regulation, B, reduction of preload, C, increasing cardiac contractility, or is it D, fluid restriction? Okay, timer's up. Next question. Number 5, a patient with ESRD, end-stage renal disease, uses UFH for anticoagulation during hemodialysis. Pre-dialysis lab showed an increase of 50% more than 50% fall from his baseline platelet levels. Which of the following should not be used as a thrombophylactic agent? Is it fondaparinux, epoprostenol, dalteparin, or is it edoxaban? ESRD patient. More than 50% fall from his baseline. The timer starts now. All right, next question. Number 6, the attending physician chooses to use edoxaban as it is the only available anticoagulant in the pharmacy. The patient was noted to subsequently develop pale, cold, clammy skin, and mental confusion. Which of the following is best given to reverse his symptoms? So is it A, aripazine, B, idarucizumab, C, adexanec alpha, or is it D, protamine sulfate? All right, time's up. Number 7, which bronchodilator can be given in a patient with BAIAE and decompensated left-sided heart failure? Is it A, B, C, or D? Timer starts now. Right, next question. Number 8, Acapulco may be used for cases of worm infections while Nyog-Nyogan is used for ringworm infestations. So which statement is correct, A, B, C, or D? All right, next question. To maximize the bioavailability of drugs given by a suppository for systemic action, which of the following should be done? All right, time's up. Next question. Timer starts now. All right. Parang kulang. This is supposed to be the next question, all right? So, nagkamali lang ng numbering. Number 11. The following statements regarding aspirin are correct except all right, next question. All right, I think that's the end of the slideshow, everyone. Okay, so our lecturer for today. Good morning, everyone. So for those of you just joining, we are having our Pharmacology Quizmaster. Okay, so our lecturer for today is, well, grabe, ano siya, top 5, okay, of the October 2021 PLE. I think October 2022. No, Doc? Tama ba?
Yes, Doc.
October 2022. So, PLE. He is from University of the East, Ramon Magsaysay Memorial Medical Center. All right. And Dr. Gamiel Galigao will be discussing with you the pharmacology quiz session. Good morning, everyone. Good morning, Doc.
Good morning, everyone. Let's start na discussing na yung mga questions para maaga rin kayong makapagpahinga at pagbasa ulit. Okay?
Nalalakas
let me
ka, Doc.
share my
Kaya alam ko 2022 ka eh.
Okay. Okay. So, kita naman yung screen?
Nawala, Doc. Pero kanina okay na siya.
Okay. So, this one. Okay. So, yeah. So, AJ, 8 years old male, underwent myeloablation using a busulfan-containing regimen. So, develop siya ng parang full palagi yung stomach, tapos right upper quadrant abdominal pains and icteric sclera. So, after noong hematopoietic stem cell therapy. So, he is febrile, tapos mildly tachycardic with an RR of 30. So, what's your answer po? Can you please chat po sa chat box?
Guys, kindly chat your answer. Type your answer sa chat box.
Okay, guys. So, yan. So, thank you for participating. So, the answer to this question is letter C, no? Hepatic veno-occlusive disease. No? So, hindi siya pulmonary fibrosis, no? We might lead to be, pwede natin isipin na pulmonary fibrosis because yung busulfan is one of the agents na nagkakos ng pulmonary fibrosis, no? Pero, kumbaga, wala naman siyang, baka nalito rin kayo doon sa RR of 30, pero normal din naman yun sa patients na 8 years old, no? Tapos yung sa acute cholangitis, no? Hindi naman niya na satisfy yung triad noong jaundice, tapos yung fever, saka yung right upper quadrant abdominal pain. Okay? So yung hepatic veno-occlusive disease, no, is a side effect of busulfan. Okay? So tawag dito. So meron siyang mga toxic na metabolites which damage the sinusoids of the liver, no, causing this entity. Okay? So let's move on to the next question. So ano yung parang reversal or salvage agent for hepatic veno-occlusive disease, no? So the answer is defibrotide or letter C. Okay? So yung leucovorin, no, is more for methotrexate, yung parang kina-counteract niya na agent, no. Yung perfenidone naman is for idiopathic pulmonary fibrosis, and studies are still underway to determine if may effect siya sa chemotherapy-induced na pulmonary fibrosis. So number 3, no? The following statements regarding the autonomic nervous system are correct except. So please answer in the chat box. So ano yung incorrect regarding the autonomic nervous system? Okay, so ayun, no? Medyo madami pa rin ang kumbaga nagkamali. Pero dapat guys, master nyo na ito, no? So yung answer for this question is letter A, no? So okay, so here's a slide noong structure noong mga neurons, no? So usually the autonomic nervous system is consisted of a two neuron system, okay? So ang isa sa mga difference nila is yung presynaptic neuron ng sympathetics, it's shorter, and the postsynaptic neuron is longer, no? Compared to the parasympathetic na mas longer yung presynaptic and mas shorter yung postsynaptic, no? So all of the preganglionic neurons, they are lightly myelinated, no? So tama yung choice ng letter C. Tapos the postganglionic neurons is unmyelinated. Okay? So ang tamang sagot is letter A. So siya yung false. Bakit? Kasi ang sinisecrete niya ay noradrenaline. Okay? So kung tawag dito, pag eccrine, so kasi dalawa yan no? Yung apocrine sweat glands saka yung eccrine sweat glands. No? So pag sinabing apocrine sweat glands, yan yung mga nasa flexural regions, no? Like yung kilikili, yung mga singit, ganyan. So they are innervated by sympathetic neurons which secrete noradrenaline or norepinephrine. If it's eccrine sweat glands, yung kumbaga yung mga normal na sweat glands all over the body, no? So sympathetic neurons pa din siya, no? Which secrete acetylcholine. Okay, so note niyo yun, importante yun, no? Na pag eccrine sweat glands, no? Sympathetic neurons pa din yung nagpo-produce ng mismong acetylcholine. Okay? So let's move on. So which of the following is the cornerstone of pharmacologic therapy in patients with non-decompensated heart failure with reduced ejection fraction? Okay. So the answer for this one is, can you please chat your answers in the chat box? Okay. So ang answer ay letter A, no? So why, no? So if you remember, no, meron tayong mga drugs which decrease mortality in patients with heart failure with reduced ejection fraction, no. So ano ba yung mga drugs na iyon, no? ACE, tapos ARBs, no, yung ARNI, yung may sacubitril plus valsartan, tapos yung um tawag dito, um mga bisoprolol, no, metoprolol succinate, no. So at saka yung tawag diyan mga ivabradine. So all of these agents, no, control modulate yung autonomic nervous system, no. Tapos yung hormonal kasi 'di ba yung mga natin, ARNIs, ARBs, tapos ACE, no, they are inhibitors of your RAAS. Okay? So halos lahat ng drugs na 'yon. Tapos meron pang kumbaga yung bago doon sa mga arsenals for non-decompensated HFrEF, no, is yung mga din, sinama na nila yung SGLT2 inhibitors, mga empagliflozin, ganyan, dapagliflozin, canagliflozin. Okay? So even if without diabetes, binibigay din siya. Okay, so number 5. A patient with end-stage renal disease uses unfractionated heparin for anticoagulation during hemodialysis. So after nun, yung next niya na dialysis session, bago siya kumbaga yung pre-labs nun, nakita bumagsak yung platelets niya. Ano kaya yung bawal gamitin? So first, tawag dito, ano muna yung consideration nyo? Can you please chat your answers in the chat box? Ano yung diagnosis? Ano yung nangyari sa patient? Correct. So may nag-answer ng HIT, si Sir Joy Nata. Thank you. Okay? So ang sagot ay, ano ba yung tawag dito? Ano ba yung heparins dito sa mga to? And the answer is letter C, dalteparin. So bawal siya ibigay kasi it would precipitate thromboembolic events. So pwede magka-stroke yung patient. Ganyan. Okay? So next, gumamit daw siya ng edoxaban, no? Kasi yun lang daw yung available. Tapos nag-develop siya ng pale, cold, clammy skin, and mental confusion, no? So mukhang parang nag-bleed, no? So nagka-hypovolemic siya na episode, no? Dahil probably because nag-bleed ito, no? So ano yung ibibigay natin dun sa patient? Please chat your answers in the chat box. Okay, so yun. So most of you answered letter C, no? However, hindi yun yung best agent, no? Pwede mo siyang ibigay kung tawag dito, talagang yun na lang yung available, no? Pero kasi yung Adexanet alpha, it would reverse yung rivaroxaban saka yung apixaban, no? How about yung idarucizumab? Ano yung nire-reverse niya na na anticoagulant? Sige nga. Okay, very good, no? How about yung protamine sulfate? Yes, no? So tama, heparin. Particularly, mas malakas yung effect niya sa low molecular weight heparin. Okay? So ang answer dito is aripazine, no? So letter A. Okay. So yung aripazine, or otherwise known as your siraparantag, no? It can also reverse other factor 10A inhibitors, no? Your NOACs, no? Yung novel oral anticoagulants, no? So yung mga edoxaban, no? Yun. So kasi yung adexanet alpha, hindi niya na nare-reverse usually yung edoxaban. Yan. So apixaban lang siya sa rivaroxaban, for point of clarification. Okay? Let's move on. No? So which bronchodilator can be given in a patient with bronchial asthma in acute exacerbation and decompensated left-sided heart failure? So please answer in the chat box. Okay, sige. So ang answer dito is ipratropium. No? So your ipratropium is a long-acting muscarinic antagonist. No? So it's a bronchodilator, no? Pero wala siyang effect sa heart. No? Unlike your yung SABA, no, na salbutamol, and your LABA na indacaterol. No? So since meron siyang beta agonist effect, no, it will increase yung heart rate ng mga patient natin. So tawag dito kung decompensated yung patient mo with with HFrEF, no? Kumbaga pwede siyang mag-push into further decompensation. Okay? So ang sagot ay ipratropium. So number 8. So anong sagot niyo sa number 8? Okay, so very good. Letter D, no? Bakit? Kasi yung pinagbaliktad lang sila actually. So yung Acapulco, no, it's used in worm infestations, no? So take note also the difference between infection and infestation, no? So pag infestation usually mga parasites, no? Pag infection, yung talagang siya, na-infect yung mga cells, yung tissue natin, no? Whereas yung infestation, more of the external lang, tapos nandun lang sila. Okay? So, pag nyog-nyogan, it's for the parasitic worm infections. Whereas yung Acapulco, ringworm, no? So, fungal. Okay? So, the answer is letter D. Okay. So, next, no? To maximize the bioavailability of drugs given via suppository for systemic action. So ano daw yung gagawin? So please chat your answers in the chat box. Okay. So very good, no? So tawag dito, dapat dun lang siya sa lower 1/3 ng rectum, no? Bakit? Kasi tingnan natin. Okay. So yung inferior rectal vein saka yung middle rectal vein, no? It drains, no? to the systemic circulation. Whereas the superior rectal vein, no, it drains to the portal circulation. Hence, magkakaroon ng first pass effect. No? So, syempre, pag nagkaroon ng first pass effect, mababawasan yung bioavailability. Mababawasan yung drug, kumbaga, na nasa systemic circulation. Okay? So, ang definition ng bioavailability, no, the drug that arrives, no, into the systemic circulation, no, after absorption, no, or syempre, pag intravenous, walang absorption. No? Okay? So, next. No? Ito. So, what's your answer? Please chat your answer in the chat box. Okay, so tawag doon. So medyo nalito, no? So tama yung thought process, no? Ang halos lahat ng barbiturates, no, it would induce, no, your CYP enzymes. However, no, there's an exception, no? So yung exception is si secobarbital, no? Si secobarbital, ang ginagawa niya, no, ini-inhibit niya yung CYP enzymes. So kapag inhibit niya yung CYP enzymes, anong mangyayari doon sa substrate drugs na minametabolize ng CYP? Siyempre, tataas yung blood levels niya. Okay? So here. Ayan. So, ayan, no? Phenobarbital, ganyan. Tawag doon, methotrexate, mga ganyan. Primidone. So all of those mga barbituric derivatives, no, would induce CYP 450 except secobarbital. Okay? So ito medyo nahirapan ako dun sa mnemonics na to, no. So usually ang tiyatandaan ko lang is all anticonvulsants are inducers except your valproic acid, no? Tapos yung usually yung mga antibiotics nasa ano yon sa enzyme inhibitors except your griseofulvin, no, which is an antifungal. Okay? All right. Sige. So, ayun yung bonus question natin. So, the following statements regarding aspirin are correct, except. So, please chat your answers in the chat box. Okay, so ang tamang sagot ay letter A. No? Ay, letter B pala, sorry. So, tawag dito, okay, so tama, letter B. No? So, tawag doon, the analgesic dose of aspirin, which is about 325 to 1,000 milligrams, no? It causes uric acid retention. So, hindi natin siya binibigay for the purpose of mga gout, no, or 'di ba yung ibang NSAIDs binibigay natin as initial to decrease yung pain, no. So yung aspirin hindi natin siya binibigay for that, no. So anti-inflammatory dose, no. Okay, so yung anti-inflammatory dose yung 4,000 to 8,000 milligrams, no. Nagiging uricosuric siya, in fact, no. So bali nakakababa pa siya ng uric acid levels, no. Okay. So ito yung doses ng aspirin, no. So 75 to 325, no, cardiopreventive, mga thromboprophylactic dose yan, no, to prevent yung stroke, heart attack. Okay. Tapos 325 to 1,000, yan yung analgesic to antipyretic. No? Kaya hindi rin natin masyadong ginagamit siya as analgesic saka antipyretic. Okay? So initially, no, respiratory alkalosis muna bago metabolic acidosis kasi ni-stimulate noong aspirin yung respiratory center sa medalla, no? Tapos nagko-cause din siya ng uncoupling doon sa mitochondria, no? So yung increase na carbon dioxide, 'di ba, dinadrive nun yung respiration. So kapag hinga ng malalim, no? Tawag doon, nagkakaroon ng respiratory alkalosis, no? So further at kumbaga pag tinaas mo pa yung doses, no? Nag-i-increase na yung bicarbonate excretion, no? Hence, nagkakaroon na ng metabolic acidosis. Okay? So, yun. Okay. So, that ends the quiz, no? So, do you have any questions?
Doc, sorry, pa-clarify lang daw nung number 10 na question. But not the bonus, ha?
Okay.
Induce, suppress.
Ayan. So, meaning yung secobarbital natin, no, hindi siya enzyme inducer unlike the other barbiturates, no. Siya ay enzyme inhibitor, no. So kung enzyme inhibitor siya, no, kasi 'di ba ini-inhibit niya yung CYP. Tapos yung CYP siya yung metabolize, no. Dinedegrade niya yung midazolam. So kung ininhibit mo yung nagde-degrade sa midazolam, ang mangyayari, tataas yung blood levels niya. Okay? Unlike kapag yung iba, for example, sinabi din is phenobarbital, no? Yun. So, primidone, metohexital, yun mga sinabi ko, yun ay derivatives lahat ng barbituric acid. Okay? So, yun lahat sila, ini-induce nila yung enzymes, no? Okay? So, tama yun, di ba? So, derivatives of barbituric acids, no, induce certain CYP enzyme isoform. So, that's correct, no? However, yung secobarbital, siya yung exceptions. No? Exception. So, ini-inhibit niya. So, mangyayari, tataas yung blood levels ng substrate drug. Okay? Yeah. So, ito, no?
Thank you, Doc. Are there
Okay,
any
clear
other
na ba?
questions? May nagsabi, Doc, any tips daw po from you?
Yeah. So, at this time, no, na memorize all the, kumbaga, drug categories, no? Master yung mga members ng mga drug categories, no? Especially kapag iba yung pangalan niya. Pero kung kaapelyido rin yan, bawa, yung mga beta blockers, ganyan, alam niyo na yung apelyido nila, olols, no? So, i-memorize nyo lang yung mga exceptions. Tapos, yung mga tawag doon, wag na kayong mag-memorize ng mga common na side effects, no? Yung mga very tawag doon, rare. Like yung kanina, yung HBOD, ganyan, no? Saka yung mga specific na tawag doon, side effects na kumbaga makikita lang sa isang drug or yung naha-highlight. Tapos, ano po ba? Ayun, dasal-dasal lang.
Correct, dasal-dasal lang.
Dasal-dasal lang.
Kahit nung time namin, Doc, dasal-dasal lang, diba?
Effective yan.
Alright.
Tapos relax lang.
Yan. May questions pa, mga babies? Anyone? Questions? Wala na yata. Alright, so kung wala ng questions, let's give Dr. Galigao a big round of applause. Thank you so much.
Thank you din po for your time. Okay. If there's any questions po, feel free to message me po. I'll be giving my email po.
Sige, no. Doc, I think Doc Broly was here kanina. May gusto ba kayong sabihin, Doc Broly?
Good morning lang. Kagising ko lang, Lala. Nandiyan na.
Uh-huh.
Good morning to everyone. Good morning to... Doc, how do you pronounce your name? Ano yung nickname mo? Dr. Gamaliel Galigao.
Gam na lang po. Gamaliel. Gam.
Okay. Ano lang, someone gave feedback to us. Just try to give more mnemonics, more explanation slides after each question. Okay? Some of your tips kung paano i-attack yung mga question, just improve yung explanation slides natin for the next time. Okay? Sige. Yun lang, Doc. Okay? Ingat. Thank you so much, Dr. Gam. Thank you so much, Lala.
Thank you din po, Doc. Thank you po, everyone.
Thank you, everyone. Bye. Share ba yung sound?
It's the thought of PM when your heart's just like a drum, beating louder with nowhere to guard it. When it all seems like it's wrong, sing along to Elton John and to that feeling we're just getting started.
When the nights get colder and the rhythm's got you falling behind,
Just dream about that moment when you look yourself right in the eye. Then you say, I wanna dance. The music's got me going and nothing that can stop how we move. Yeah, let's make a place and live just like we're golden and rolling like we're dancing fools. We don't need to worry, just when we're from we know how to dance. Don't need to talk the talk, just walk the walk tonight.
Good luck, everyone. You will do well. You can do this, and God bless you. Bye.
Hope is a good thing, if not the best of all good things. And no good deed ever dies. Good luck, everyone. God bless you.
Just do what you have to do. Focus lang. Block out all the noise. Focus on yourself. Focus on the examination. Tiwala lang sa sarili. I'm sure you're all going to succeed. Alright? So, good luck, guys. I'll be praying for all of you.
So, mag-aral mabuti, magpabakuna, okay, mag-iingat, and God bless you. Ingat!
Hi guys, I'm Dr. Denver Tiongson, the head of the Department of Internal Medicine of Top Notch Medical Board Prep. Together with me is my son. What's your name?
Matthew Damian Lalag Tiongson!
Yes, he's also the son of Laline Tiongson, your teacher in Prev Medicine. On behalf of the entire Top Notch family and of course the Department of Internal Medicine of Top Notch Medical Board Prep, we bid you good luck and God bless in the upcoming board exam.
I wish you all make it. Okay, so I only wish the best for all of you.
So good luck, everyone. We're all praying for you, and we really hope that that we will soon meet you in the clinics as physicians in the future. Good luck, everyone. Lots of love from me and your Mother Goose MM.
Congratulations in advance for batch 2021. Thank you for making me part of your dream. God bless and good luck in your exams. I know you can make it. Remember our mantra, in due time we shall reap if we don't lose heart. Marami pong salamat and God bless everyone. Thank you mga anakis.